Welcome people across OSU campus and welcome people at the Fawcett Center. Thank you so much for participating. We're really excited about this panel and it really has been a treat to be here for the past day and a half to just like by osmosis take all of this collective wisdom of the ethical challenges that people have been facing on the field and thinking about research ethics and humanitarian crises. So my name is Dana Howard. I'm from the Center for Bioethics at Ohio State. And I'm going to be moderating the CARE panel. So CARE is a program through the Center for Ethics and Human Values that was created to provide opportunities for researchers across OSU to have these sorts of conversations about research ethics that go beyond regulatory oversight and research integrity, basically beyond checking boxes. And this is our third session. We've had one on the ethics of reproducibility and one on conflicts of interest in research. And so we're really excited to have Veena, Aaron, and Marcel here to discuss today the ethics of research in humanitarian crises. So disasters and conflicts, and I should say that this is funded by the Office of Research and it's supported by the Center for Bioethics and the College of Public Health at Ohio State. So disasters and conflicts lead to crises that call for humanitarian responses. How can we know that the type of response being provided is actually effective, is timely, and is the best use of available resources? To answer these questions, there really has been this recent drive to try and get more evidence-based practices. But with that come the ethical challenges of dealing and working with research participants, human subjects that are in very vulnerable and precarious situations. And so today we're going to be talking not only about sort of the ethics of engaging in humanitarian research, but the ethics of engaging in research more broadly in humanitarian crises. But I think many of the lessons in the cases are going to be able to be translated across questions. So we have as our external expert, Veena Pillai. Veena combines her medical license, research, and interest in humanitarian work with refugees in Kuala Lumpur and Penang, Malaysia. She's the director of DHI, which is a consultancy focused on humanitarian research. She's really consulted in across the globe when it comes to humanitarian research, and she currently also works with Medicine Sans Frontiers in providing basic health care to refugees in the Rohingya crisis. Her current research is in the areas of refugee health and disaster response. So Veena is going to speak for 10 to 15 minutes to just sort of present some of the important ethical challenges that come up in this context. And then we're going to have two of our guests from OSU respond from their own experience and their own ethical challenges working in the field and working at OSU. So we have Erin Lin, who's an assistant professor of political science and global food politics at Ohio State University. Her research focuses on the legacy of war on development. She studies how unexploded ordnance disturb daily economic activities and have long-term consequences on post-conflict recovery. For example, she's worked in Cambodia to explore how bombing in high fertility land can result in an increase of likelihood of subsistence farming. She's a team member in the Initiative for Food and Agricultural Transformation, in fact, at OSU, which is a university-wide effort to encourage cross-disciplinary research. And her collaborative research projects include the use of machine learning models to identify bomb craters and the location of unexploded ordnances. And then Marcel Yotabieng is associate professor in the College of Public Health. Over the past 2 decades, he's worked in multiple countries in sub-Saharan Africa as a clinician, as a public health practitioner, and as a researcher. He's also the co-investigator on large cooperative agreements from the NIH and the CDC that have basically funded Um, they've provided him and collaborators an opportunity to build strong research infrastructures in the Democratic Republic of Congo. Um, so what we're going to be doing today is we're going to first, I'm going to give Veena an opportunity to come up, give sort of a 15-minute presentation, and then I'm going to give Aaron and Marcel an opportunity to present their own perspectives and some of the ethical challenges that they've met. We've come up with a set of questions that we think are really interesting, and we would love to hear across discipline how people have been thinking about them. And then the doors are open for you. And so what some of you at the Fawcett Center, some of you at University Hall, and other people on campus, if you have a question, it's going to magically appear on my computer. I don't know how this happens, but what you need to do to ask the question is to go to go.osu.edu/ask and start writing the questions. You could actually like see what other questions people are asking and like upvote them. And basically, you could ask those questions throughout the presentation. So don't wait until the end when something is really interesting and you want to write it down. Do it whenever it comes up. All right. So to no further ado, thanks so much for coming, and let's get Veena.
Right. Thank you, Dana, and thank you to the university for bringing me here to be on this panel. I know I've met most of you already, but for everyone else who was not here yesterday and has not been at this conference, I'll just explain a little bit about why I'm here and what I've done in terms of research ethics. I'm a medical doctor and a researcher, and I have a independent ethics, a research consultancy that does research with humanitarian research, and or in the humanitarian sector. And we basically are part of an independent ethics working group in Kuala Lumpur, and which provides, well, our aim is to increase capacity in existing in IRBs in the universities there. But our ethics infrastructure in the humanitarian sector is quite poor. So we're trying to build that capacity within NGOs and within these IRBs. And in the meantime, we are offering ethics review for projects that don't have access to a university IRB. So projects like within NGOs or projects from the United Nations or other international bodies that may not have an IRB for them to access, we actually have a group of experts that are in the process of being trained to be reviewers, but are doing the reviews of proposals where otherwise there would be no IRB review. Sometimes we have researchers coming from overseas who the international university has waived the need for a local IRB. But we, in that area, we don't believe that international IRB can understand the context and understand the risks and the benefits when it applies to the vulnerable population in question. So that's what we do. So I'm just being asked to do an overview of. It's not coming down here. Sorry. Just need to. Okay. So I just want to talk a little bit because the topic is humanitarian crisis and what does this exactly mean? Like in this conference, we've heard from like everything from the Ebola virus to protracted crisis to so many different things. And what does this actually mean? And even in terms of humanitarian health or humanitarian research, it is really difficult to define. So we've got acute versus protracted humanitarian crisis, acute meaning like earthquakes happened yesterday. How do we respond? What kind of research is needed? Or the earthquake happened a year ago, and there are still consequences. It still is disaster or humanitarian research. And what is the difference there? The first one, we have time. Time is of the essence. If you need to react, we need to react now. We need our ERB review now, and things are very different. Whereas with protracted humanitarian crises, we can think a little bit more about what we need to know, how we're going to do it, how we're going to do it safely. And it's a little bit, but maybe we can't get the right information that would help us if this emergency struck again. what about humanitarian situations outside the crisis, like prisoner conditions or people who are discriminated against? These are still considered humanitarian, but we don't really think about this when we are talking about a topic like this. Survivors of emergency situations are vulnerable populations that which at wherever on the timeline that might need special protection from exploitation, in which this topic, ethics in the research that we are doing, is especially important. So when you talk about evidence-based practice in humanitarian crisis, there's really a challenge of like developing guidelines in such a dynamic, diverse field. I've just talked about how these things range, how these crises range. How are we going to have one set of guidelines to talk about, a multitude of different situations that could arise? It is it's really a challenge. And I think we should do it. I just think that we need so many people involved to have a really good, and it will have to be quite broad, and people will have to be trained in them to do them. So, yeah. There's also a paucity of evidence to guide response in disaster settings already. These numbers are coming from 2005, and I really do hope in the last 14 years more information has come out. But 1% of published disaster research articles are about lower and middle income countries, and of that 1%, 80% are authored by researchers from high resource countries. I know there are a lot of efforts to change this and increase the capacity from people in LMIC. And the fact that I'm standing here is I hope that's a good symbol of that. And I hope this increases, and I hope it has changed, but these are the latest numbers I could find. So when we start thinking about challenges in ethics, we start from not just, I think a lot of, again, not everyone in the room, but a lot of people start thinking about ethics when they submit their ethics review proposal. And actually, it should start from choosing your question. The question in itself should in some way benefit the victims of the crisis, and the topic should be relevant and appropriate. It may really seem obvious, but I constantly get surprised at what topics come up and get presented to me in terms of like trying to support survivors who are in a protracted crisis. These 3 points that are up here have been taken from the Nursing Code of Emergency Response, but are really relevant to what we are talking about. Research should always be responsive to the needs of the victims of the emergency. Only research that does not hinder or obstruct effective and appropriate interventions should be carried out, and research should improve interventions and or local capacity to respond to this emergency or future emergency. When we think about methods, we think about how are we going to access this population? Can we access this population safely? Safe for us, safe for them? Who are our key persons and authorities? Are there any risks of choosing these people as our key persons and authorities? Do these key persons really represent the community and all the sub-communities within that, all the possible marginalized communities? How are we going to sample? How are we going to make sure the sample is good? How are we going to make sure we're not oversampling if research has been done in this community before? How are we making sure we're not sampling the same section of the community again and again if the same key persons are being used? And how are we going to ensure, especially in acute crisis situations, that we can maintain scientific rigor in our research? And at what point do we stop the study when we think it's not going to maintain that scientific rigor anymore? Ethics Review Board, there's a lot of discussion about pre-approval, which maybe Amit can talk about a little more after. Oh, it's not. Oh, no. Thank you. What's happening? So there's been discussions about pre-approval of ERB, so that if you you want to study this and you know it's going to happen, or it's in a place that has happened before and you think it might happen again, or the disaster response has been prepared for that, then this is a good one to do a pre-approval of an ERB, so it's a lot swifter and smoother when disaster does strike and you need to go in. There are, of course, exemptions, especially if you are doing operational research and you're using, it's not research with human subjects, but of course that still needs to go to the ERB. I mean, the researcher can't decide that that's exempted. It needs to go to the ERB to exempt that. I think that's how it works here. It definitely works like that in Malaysia. In terms of respect for persons, we need to think about informed consent. Are the people who are subject to this crisis ready to be able to provide informed consent? Are they in the right state of mind? How can we do this? How do we want to do the process? What are the cultural and language barriers? How are we going to overcome it? What is the literacy level in the population? These are all potential challenges. There's also a power dynamic for foreigners that are going into a response thing where people feel there might be some authority, or especially if you're going in with like medical personnel or stuff like that, they're providing medical care, they may feel an obligation, they may feel that they cannot say no, or maybe you would cut off other services. And of course, trust and relationships are really important in this, and you must not abuse those relationships, and also fostering that trust is a delicate thing. In terms of non-maleficence, I think one of the most common things in crisis are triggers and mental health, especially in the work that I do with in a protracted crisis. We can really try to minimize this by having a psychologist or a psychiatrist look at the questions to see if there's any way you can make the questions less triggering. We have found that really helps. Having all researchers and everyone on your research team trained in psychological first aid is also useful, or having a mental health pathway if this happens. Of course, if this is a high risk, I would reconsider doing the study at all. Possible consequences of results, for example, in conflict zones or in areas where the results might actually adversely affect the population. This needs to be thought about. Exploitation, if you're giving incentives, or if you are paying a key person to help you do the study, this might lead to exploitation. And of course, you must ensure that relief efforts and other delivery of care that might be going to these to the survivors are not hampered. Okay, so my whole talk yesterday was on beneficence, so I'm sorry for having to repeat myself, but it is something I feel really passionately about, because at the end of the day, while we also don't want to do harm, and that is really an important starting point, we must think that research in humanitarian crisis can only be justifiable if it really concretely contributes to the ending of that suffering. It has to be appropriate for the study population. There are lots of arguments about compensation versus incentive, where the incentive might lead to coercion. So getting the appropriate amount for compensation can be tricky and takes a lot of work that you might have had to do before disaster strikes, and might change once the crisis has happened. So this is stuff to think about. Implementation science is an important thing to think about, and I think it's growing in this sector, so that you can give at the same time services as well as collect data on how to improve those services. I've already mentioned this, but to make this beneficial to this community, you have to make your study have scientifically sound. And of course, have a data dissemination strategy. If your dream is to like impact policy, that might take a little bit longer, but the easier way to do it is give the information back to the community or to the NGOs that are serving that area, and then you've already impacted in some way. I think I've mentioned this a little bit, so I won't spend much time, but like make sure that participant selection is fair, the form of beneficence that you are providing is fair for everyone and fair for people who are not getting it, and make sure that the community leaders aren't selecting people out of favoritism or anything like that, which I think is one of the major challenges of doing this kind of work. Okay, so to end, start early and think of ethics from the research question to the data dissemination to the thoughts of impact of your study. Ensure that the basic needs of your study population are met before beginning. Submit for ethics review early. Collaborate with key persons from the community and make sure that they're representative of the community, and always assess for an appropriate compensation. Thank you.
So now we're going to have Erin Lynn talk about her experiences on the field in her research and how she's been thinking about some of these questions.
Great, thanks, Dana. So I'm a political scientist, and I study the legacy of war on development. I focus on the role of bombing and the fact that not all bombs detonate when they hit the ground. So I really study the unintentional detonation failures of bombs and how this has long-term unintended consequences for development, particularly in Southeast Asia, and I focus on undetonated bombs following the Vietnam War. So all of the research that I'm going to be talking about right now, it will be based in Cambodia. I rely both on quantitative and qualitative methods to address this topic. So quantitatively, I use declassified US Air Force records of payload drop points, and I merge them with farmer surveys from Cambodian farmers today to basically develop this theory and have this finding that where there's more unexploded ordnance, there tends to be more subsistence farming. But then I also use qualitative data where I basically go back to the field, back to Cambodia each summer, conduct farmer interviews, and do ethnographic observation of demining teams as they're clearing land. So for today's panel, I wanted to bring up two projects with their own ethical issues. The first one is a project that Dana had actually mentioned, which is the TDAI project, where we develop a machine learning model to find bomb craters on very high resolution satellite imagery. And the hope is that by identifying the bomb craters, we pair this with the declassified US Air Force records to get an estimate of where there are areas that are very dense with unexploded ordnance. And this will provide more information for demining teams to use to find, to be able to demine more contaminated areas. The second project is a project that's sponsored by the Food and Agricultural Discovery theme at Ohio State, and that's a soil contamination project. So what I actually did last summer with a team of 2 students from Ohio State is that we went to the field to shadow demining, a couple of demining teams, and we would collect soil from areas where there have been unexploded ordnance, so within a meter, 3 meter, and 5 meters, we would see if the soil in these areas next to a bomb actually had any indicators of more heavy metals, more toxic residuals that could be coming out from these bombs. So this project brought up a few ethical issues, partially because these two questions of how are the best ways to locate unexploded ordnance, and then also do unexploded ordnance leach chemicals into the surrounding environment. These are what I consider frontier questions, and the way that a lot of research hasn't really looked at these particular questions. And so it really brings up this issue of what do we do ethically when we just have preliminary findings or we just have pilot data? I like to use the soil contamination project as an example because what our initial findings reveal is that where there are unexploded cluster bombs, within 1 meter of that bomb, you find about double the amount of lead and arsenic than you would 5 meters away where our control soil would be. The other research design that we also implemented was that we wanted to see if detonation practices were actually good for the environment. Because what happens, or the current standard, is that if a professional demining team finds an unexploded bomb, once they locate it and confirm that it is a bomb, they detonate it that day. So what we did is that we also tested soil from the detonation site and the areas surrounding the detonation site to see if there were heavy metals and explosive materials still in these areas. And we found that there's 4 to 5 times the order of magnitude of lead and arsenic in these detonated areas compared to control areas. The issue is that since this is a pilot project, we don't really have a large sample size. And so this basically motivates a larger, hopefully multi-million-dollar grant proposal in which we can increase the number of N to see if these are like actual conclusive results. We also need to run many more tests to see what the impact of having these heavy metals would be onto soil health and human health. So you need to run things like bioavailability tests and soil organic matter tests to see if the surrounding soil is actually absorbing any of this heavy metal material and the degree to which like plants and humans exposed to this material would actually be negatively harmed. So it's kind of dangerous to run around with these pilot findings, like potentially throwing up all these flags when we're not even sure how conclusive a lot of these results are. And we're working on an academic schedule where I have to wait a couple of years to write the proposals, see if I win the funding before we can actually scale up some of these projects. The other thing to consider is that the more time that we spend trying to work with the deminers to collect these soils, the less time they actually have to demine the areas that they're working in. So we try to be cognizant of taking as little time from them as possible while also trying to maximize the amount of information that we're drawing from the field. So the solution that we've come to right now, and I don't even know if this is the best solution, but we've basically, my co-PI and I have drafted a pilot report saying, like, you know, with these amounts of lead and arsenic in the surrounding soils, we would recommend farmers not to farm within 3 meters of a detonated bomb. But this is still up to many more tests, and we still need to confirm this result. But this is what we would share. This is what we are sharing with the NGO that we're working with that actively demines the area, with the idea that they're going to then use their community liaisons to share this information, since they're already out in the community telling them about other safety regulations regarding unexploded ordnance. So that's the anecdote that I'll share, and I'm happy to talk more about the other project, the bomb crater identification project, and the hazards that come with that in the Q&A.
And Marcel?
My name is Marcel. Can you hear me? Yeah. My name is Marcel Yotebian, as you hear from the introduction. I'm originally from Cameroon. I work in a number, I'm a physician and a public health practitioner. I consider myself an implementation scientist. And can you hear me? Mm-hmm. Okay, is it better now? Yeah. Mm-hmm. So what I will bring into this and bring it is actually the experience of healthcare provider and somebody who do research in those areas. And first of the thing I will ask is that you have to think about the context when we use the word humanitarian. We are already talking about in a context in which the power relationship is disturbed. Those who come in to do research are extremely powerful, have enough resources. Even if it's a small nurse or even if it's a small community health worker, they move from we just have a cyclone hit the southeastern Africa. Even the simple somebody from the neighboring village who is not officially who walk in with potable water have huge power because you need that water. You need it to survive. And it's very difficult to negotiate anything in this condition, let alone arguing whether you should have it or not. And the example I want to bring here, I was part, I don't know if some of you have read the report Crossing the Global Chasm, Improving Healthcare Worldwide, that the National Academy put out last September, October. I was part of that committee that put out that report, and I took actually the committee to travel to Central Africa, to Eastern Congo, and Rwanda to see actually offhand, and there is some ethical issue that we still have. We have referred to the National Academy Ethics Committee that we still have not. But when I bring that report in, I'm encouraging you to read it for one thing. It's unethical, the way we practice humanitarian medicine now, because we don't have evidence whether what we do is actually helpful or not. If you read that report, you will see that we need research in this area. So actually, the ethical thing is that we need research in area. And my point would be, I was making this with Veena before, is that for the regulatory people that are on this, in this room, I understand you want to protect. I understand those people are vulnerable. But don't let the fear prevent the research to happen. And I'll give you one example. In DRC, last November, DRC approved the vaccination, the revaccination for those. It's compassionate. We don't have enough evidence if those vaccines are safe against Ebola. And they approved and excluded pregnant women. Pregnant women, from the experience we have in West Africa, is that they would die If you're a pregnant woman and have breastfeeding, you have just signed your death certificate. You can just go and sign your death certificate. So we exclude them from those things by arguing it's not safe. Tell to me how do somebody come out with this conclusion, right? What is safe? This woman is going to die. It's almost certain. The only chance she may have, even though this may kill her before the Ebola kill her, is this vaccine. But we exclude her from receiving this vaccine because we believe we don't have data from it. And for many regulators, you know in this room more than I do, that it's only recently, only this couple of months, that we have removed pregnant women on the list of vulnerable. They were classified as mentally disabled, on the same list as mentally disabled. So this is to say that when we talk about vulnerability, about the risk, we have to assess the risk based on what actually the need is. The risk is not in a vacuum. The risk for somebody here in this room to be exposed to 5-level arsenic may be intolerable. But in some area, that risk may be actually much more than reasonable because the opposite is worse than that. And we have to bring all of this. So these are the two things. I will not take a lot of time. I will encourage you to read that report and see that we actually have a full chapter on practicing care on those marginal areas, right? Which you can even classify informal care in multiple of those countries with chronic poverty, because that's also a humanitarian situation, which is what I actually very well used to. With those chronic poverty, we are practicing services there or doing research. We need research in those areas. And how do we do it? And how do we do it in a way that is ethical? And usually when we think about ethical, we only think about it in the way of protecting the patient. Also, the one who is doing research needs some protection as well. Within that committee, I mentioned to you that we went to Goma and that we have something still pending with the ethical committee. What we saw there is that patients are retained hostage after they arrive for receiving care because they don't have the means to pay. They are extremely poor. And you see children that stay in hospital up to 3 months, 6 months, growing in a hospital, which is actually very dangerous, right? This is not the cleanest places to be growing up. This is not even the places to think about growing up in it, or even to think about visiting, right? Hospital is not the cleanest place to go. If you don't have anything to do in hospital, don't go. As a clinician, I will tell you that. So it's not the safest place to be. But you have children that are being retained to grow in this because their mom cannot pay the bill of their delivery. And the question is, if you don't pay, if those people do not retain the patient, the ethical question on the other side, because we think about those patients and say they are being retained, if you don't pay the bill, the hospital will collapse and then not functioning. Whose ethical responsibility it is to maintain this hospital open? So these are just a few questions that I will have to raise. I'll stop there.
Well, thank you. So now we're going to go into this sort of, we have a few questions that we came up as a group, but please, if you have questions, go to go.osu.edu/ask and start typing up questions. So the first one, and it's already been touched upon by some of the speakers, but I just want sort of ground clearing. I think the most fundamental question is, why isn't research necessary in these humanitarian crises or these post-humanitarian crises? Why not just provide the best possible and evidence-based interventions and aid that we can offer given the resources?
I can start directly from there because that's what I just end on. Because what is the best evidence base? Currently, we say the best evidence because we don't have evidence. Anything I do is best evidence based, right? Everything I show up and do on you there, if I operate you without anesthesia, that's the best possible we can do, right? They did that in the Napoleon army. That's how they developed the surgery and all the amputation. When they amputate soldier in Napoleon army, which saved a lot of life, it was very better than what was previously done. But they just cut your leg in the field, and it was it was actually improving the life. If we were in that condition, I would say that's very ethical because this is the best medicine you can have. But is that really ethical today? Is that really what the best we can afford today, even in those conditions? Even in an earthquake, that things are not coming in very quickly. Is that the best we can afford? So I think we need absolutely, there is very little evidence. And actually in your presentation, you were citing things from 2005. We are in 2020 roughly. Because the research that is submitted now will only be published next year. So we are already in 2020. Those research, if you were in the field of HIV that I spent a lot of time, that thing would be like crap, right? You cite something of 2005, it would be like crap, right? So it's just kind of the way we absolutely need research in this thing. I would encourage you to read the report I just mentioned to see how much we need the research in this area. We cannot just, we need to define what is the best we can offer in this area. Is the best contextual? Is the best because they are poor? Is the best because the access is not reachable, right? Is the best when we look at the WHO definition of potable water. The WHO definition of potable water is the water you usually drink, right? It's a water you usually drink, which doesn't mean it's actually potable, right? If I find myself in the flooded Mississippi with in the flooded Central Eastern U.S. currently with water that we usually drink, that water may not be safe for you, right? The tap water may not be safe for you because it's been contaminated and the government is saying we cannot clean that, guarantee that water. So this is where what is best, and without research, we will never be able to develop the evidence, acceptable evidence, even for those locally, to be able to do that.
Thanks. I agree with that. So I think research obviously plays an important role in trying to figure out the best way to distribute aid, in the way that it's always helpful to have a third-party observer and someone who's probably a little bit more objective just tell you what general trends are. So I think of it analogous to like the role of a therapist in trying to help like you navigate your own life. Like we all try to make the best possible decisions that we can given these like environmental circumstances, but it's nice to have someone who can kind of observe what you're doing and tell you where you're kind of screwing things up and you might not recognize it. So I think like research can play the same role, and like the best possible relationship that you can have between a partner organization and a researcher is an honest one. And so one where like the organizations that I partner with basically give me free reign as much as possible to access all of their data, and they trust me that I'm going to try to give them the most kind of objective and thorough analysis of that, and we kind of see that we can help each other out in this very specific way.
I just want to add that, I mean, I obviously agree with the other panelists, but I think it's clear that we need research in humanitarian crises, but I think that publishing a paper does not always lead to action and change in the field. And I really think it's the researcher's role is changing to ensuring that your results and your evidence, if you've got some really good evidence, like making sure it goes back to the community that you studied or the population or the area that you studied, or something that's similar or that could apply to other similar crises or things. I do think that even if it's not, you don't have to do it yourself, like making sure that it gets done is going to really help in making sure there are evidence-based practices, because from the NGO world, it is really hard to find the time when you are often just reacting to things and you're just reacting to services. And it is so nice to hear people come and say, like, this is how you can do it better. Actually, what you're doing now, sometimes that's not that nice to hear, but it's still important to hear that what you're doing now is not that effective. There's a better way for you to do this. Even if NGOs don't like to hear that, they should hear it. And I really hope that like we're going to change how NGOs and service providers and academics communicate the information and improve things in terms of evidence gathering.
So many of the issues that you're bringing up are present challenges in research ethics more broadly, and especially when it comes to research ethics that come from well-funded, high resource countries in lower resource countries. So I'm wondering if there is something distinctive about conducting research in humanitarian crises or post-crises, or if is there some sort of, what is the qualitatively distinct, or you think the most important ethical challenge that makes it a little bit more of a distinctive challenge in these contexts as opposed to the more general challenges that many researchers face?
We have talked already about the issue of imbalance of power. An imbalance of humanitarian setting is by definition a setting with imbalance of power. Those who have and those who do not have. Whatever you have is something somebody don't have. And even as a researcher, coming into it, you have enough more power because you have the time that she's talking about. You have the time on your side. You can be patient. You can be distanced from those things. You are not emotionally involved, which is also a matter of power. But the key ethical issue is the matter of consent. And usually when we talk about consent, it's usually that we have an informed consent. And the informed consent here is not just the patient. The example that I just give you in the Democratic Republic of Congo, where pregnant women were excluded from vaccine, did somebody ask their opinion? Did they consented to be excluded from this vaccine trial for their safety? Did we consulted them? And this could be true on many pregnant, there are many women in this room. This could be true on many medicine that we do exclude. If you are a practitioner in this room, you know that most of the things are labeled that we don't have enough. The label on most of the drug is that maybe you shouldn't use it in pregnant women because we don't have a lot of information on it. But we only know maybe about 4 or 5 drugs that are pure, that are really teratogenic. Why are all pregnant women excluded from all the drugs that have no relationship to that? And that's also an issue of consent. The consent is not only when I present in front of you to ask you for a consent. The consent are decisions that were made out to exclude you to even have a chance to consent to this. And now when I present in front of you, I'm the one in position of power. You need to go to that clinic. The NGO is the one distributing water, distributing food ration, distributing all of those things. And they ask you to sign a paper to also give you a name, like we came here, we have to sign a paper to agree to put our whatever is our voice out there. And everything was dependent on that. If we didn't sign it, maybe we wouldn't be sitting here. Did we really, our consent was it really informed? So these are the questions, and in those conditions that the imbalance of power is such that I cannot just turn around and go somewhere else. How do we ensure that? So I think that's the thing I see as critical, because we have an imbalance of power. We have people who make decisions before they arrive to the setting, what they bring to the setting, before consulting us, and it's very difficult to handle all of those.
Yeah, I think one of the things that might distinguish research in humanitarian crises compared to other types of social scientific research is just the timeline. So we usually, when we think of a crisis, there's like this immediate need for something that has to be addressed. I might fall on like the other end of that spectrum, since I study bombs that have been sitting in soil for about 50 or 60 years. And so I think plenty funders just think, well, it's another 5 years. But then I always like to make the argument that like this research is necessary in the way that it also helps us understand unexploded ordnance in like contemporary contexts. So like by us understanding the degree to chemical leaching or how to better locate cluster bombs in Laos, Vietnam, and Cambodia, this will actually help us understand exactly where we might need to bring in aid missions in areas of Yemen that the Saudis have bombed using American weapons, right? So that being said, though, I think there are all of these ethical concerns concerning how you can make sure you conduct research in an ethical way when you're in a crunched time horizon. as it's just people make decisions very quickly and you want to make sure that the aid gets efficiently distributed. And I don't have the answer to those questions since that's, I guess I haven't thought about them as much since I study kind of the long time horizon.
I mean, it's all difficult, but I think it's all difficult because in the humanitarian research area, I mean, whether it's crisis or other reasons, like basically we're working with vulnerable populations, and the difficulty with that is when you're on an ethics review board and you receive training for it, you do your prisoners and your children's and all these other special populations that might need added ethical consideration, but you don't have that for disasters or humanitarian sectors and vulnerable populations that have unique needs. Whereas when you're in a non-humanitarian thing, you think, okay, the ethical principles are quite simple. Autonomy, like I'll just tell this person everything, and then they make that choice, and suddenly I'm a bit more unburdened with my need to make sure this is fair because you and we have the same understanding of things, and it's a little different. Whereas you go into a humanitarian sector, the culture is different, the language is different. You have so many things to navigate. The chance of you making a mistake is quite high. I think this is, I mean, it doesn't really answer your question, but it just makes the whole ethical thing not just 4 principles. It's 4 principles that are overlapping and added onto and really, really quite complex. And I think that makes it difficult.
So Marcel has already brought up a case of a population that should be a research subject that is not, but I'm wondering if sort of the reciprocal is the case. So are there conditions or certain populations where research is not appropriate and the priority should be solely on providing aid? You could think about that in more abstract terms, but I'm also very interested if you've ever come across in your research a situation in which your role as researcher felt inappropriate, and what were the risks of providing aid while doing research, and how could we avoid those risks?
I think that if your study is not appropriate or like extra research is not appropriate, you can think about looking at what service delivery is there and assisting whoever is providing that service with a way to do operational research so that you're not taking extra from the community or not adding onto it when it's not appropriate. For example, if basic needs are not met and people don't have, shelter, food, health, access to health, then maybe research is not appropriate. But if you make it operational and you just make sure that people are collecting the right data so that we know how to improve it. I'm not saying like you trick people into doing research, but if you de-anonymize it and it's not actually taking away from human subjects, that will make it much more acceptable than saying, oh, here's some food, can I do a survey and take 15 minutes of your time while you're traumatized and while you're suffering. If you just focus on the operations and think about how to improve that, then I think that works. I do have an example of newly arrived Rohingya refugees coming to Malaysia. They've been on boats for 24 hours, been through possible torture, possible sexual assault. And I think I mentioned the case yesterday, and people wanting to do HIV screening for this population, just focused on HIV and the prevalence of HIV among Rohingya refugees in Malaysia was, their title. And I was saying that we actually stopped the study and said, if you want to do anything, you can do a comprehensive response to people who are survivors of sexual violence, or you can do that, but you can't just do surveys to see if they've got HIV or not. And so that was quite a difficult study to stop because it was an international study, but we did it, and it was definitely the appropriate thing to do.
Question by say, she used to keyword operational research, which is also what we call implementation science. And from there, I will say there is clearly not a situation that research cannot be done. Are there research that cannot be done in certain situations? Yes, she just gave an example, right? That research was not benefiting directly those people who arrived. It may benefit them on the long term, but their immediate need is not to know whether they are going to die 5 years from now of HIV or something. They just need water and some rest and get mental support. So this is where there is, for me, if you are providing any services, you have the opportunity to evaluate whether that service could be provided in a different way and a better way, or could benefit the population you are servicing in a different way and a better way. And that's what she's calling operational research, or what I'm calling implementation science research, right? It's exactly, once you meet those people, even your interaction, even if you are not providing any services, just your interaction with them, you want to be able to say, is my interaction with you here actually beneficial to you, or is only beneficial to me? Is there a way I can make it more beneficial to you? And when you ask those questions, they are research questions, because if I have had those answers to those questions, I don't need any data, right? So this is, my answer to that is that never think that there is a situation that you cannot do research. Every single thing can be improved. And if you can improve it, you need data and evidence to improve it. And that data, you can call it whatever, operational research, implementation science, it's research. Let us not get lost in word. The question is a research that is more appropriate in certain contexts or in other? Definitely, right? Definitely, certain research will benefit certain population than other. And even within a given population, if certain research can wait, as you were talking about the bomb, if those people in the area actually, they may be benefiting much more now for that, but maybe in Yemen, you just mentioned, the research going there and see whether the bomb explodes, whether the soil is contaminated, may not be much more appropriate now that the bombs are still falling, right? Maybe you should wait a little bit to see whether that is so.
I have a slightly different, I guess, take on one of the questions, which is how many or how often do I encounter situations in which I felt my role as a researcher was inappropriate? And I feel this way all the time. So when I conduct a lot of interviews, most of my interview subjects will always ask for like money or resources, personal pleas for help. And there's certainly, I think, an understanding that like we're either like very, very closely tied to like the organization that is in charge of making decisions of who should be receiving demining services first, or like, you know, we're just tied to money that we can easily hand out. And as a social scientist, that's really difficult because then you're getting biased results where people might be inflating the degree of need because they think it'll increase their likelihood of getting that service. And what's really interesting was that I was able to kind of compare what my interview findings or my interview responses were like when I did interviews before I had a soil contamination project compared to after a soil contamination project, because when we're out there collecting soils, that looks like, that's like I mean, I didn't need to fill out an IRB for the soil collection part. I can just take the soils with permission from these various fields in Cambodia. And so like farmers are typically just like curious after we get permission, and then we'll just like hang out with the farmer, and I have to like do a little bit of a cataloging of how that land is being used and whether or not there's fertilizer associated with that land. And like then like we'll just launch into these very natural conversations of what their like everyday livelihoods are like, the degree to which they feel like poor or like are a subsistence farmer. And that's a very different conversation than these more structured interviews that I also do that are absent the soil testing. Yeah.
So I'm going to ask one more question from the structured conversation. There's a ton of questions from the audience, so I want to get to those as well. So this is just one final question that we haven't touched upon. Well, the timeliness has been brought up as a challenge or as a distinctive challenge. And one issue, especially with humanitarian aid after natural disasters, but you could also think about it with man-made conflicts, is, you know, some of this research is being conducted in a very short period of time after very unpredictable events. So how can you plan and sort of ethically have the foresight to think about engaging in research given the unpredictable nature of some of these crises.
It's crisis by crisis, right? Because some crises, although we cannot predict exactly where it will happen, we know it will happen. Ebola example that I just used is one example. It was in West Africa, 2013, 2016. Now it's back in Congo. It will be tomorrow somewhere, right? So we can, and the trials that are going around that Ebola crisis now in Congo were started in Guinea and Liberia. Those vaccine and treatment that are being used, they started doing it in Guinea and Liberia, and now taking advantage of this opportunity to expand it. So for some crisis or the next flooding, there will be a next flooding somewhere, or the net drought, it will be somewhere, something. There are things that are uniquely rare, and that probably you can really, the bomb, there will be a bomb somewhere tomorrow, right? We don't know where would the next war will be, but there will be a war. There will be a war sometime soon. It's in Gaza yesterday. It started in Gaza yesterday. So there is always those humanitarian. It's unpredictable where they will happen, but they are not so unpredictable. And if you look at being a physician and doing infectious disease, if you look at the leaks as the next pandemic, the WHO come out with this X disease that is going to be emerging, which is the X disease we don't know yet, right? Because there are some new disease that always emerge, and we have Zika recently, we have SARS, this is going to emerge very soon. But currently, there is a lot of preparation. The World Bank have a meeting. I have a commission in 2016. They issued their report in 2017, and they are investing currently to actually prepare for that X disease that is coming. So we are investing already in research capacity and planning those research for that X disease that is coming. And we know it's going to come somewhere. So all of those things is just to really think about what are similarity, what are we trying to anticipate, what are questions whatever that catastrophe, whatever that humanitarian situation will be, that we will have to answer that we don't have answer now. Or if we have the answer, it will be helpful. So it's just been a good researcher and anticipating what the things will be, what is the limitation on the current policy, what is not working well, and how can we better use the next opportunity we have to optimize on those things.
Yeah, I think about ways to limit risk for my research participants all the time. So since I work in minefields, I don't want to go and ask a farmer to take me to their minefield and show me where they think mines are, even though that's information that I want. And instead, approved by the IRB, we then we'll have a drone image of their land, and then we'll say will you kind of mark out areas that you think are dangerous and areas where you think aren't, and areas that you farmed in various ways. And so that's I think that's one example, a way that we're trying to limit risk to research participants. The other thing is that when I mentioned the soil contamination project before, that's actually always done by shadowing a professional demining team. So it's not like we go out to a farmer where their land is contaminated with unexploded ordnance, and then we're like, hey, will you take this plastic bag and fill it up with dirt next to where you think a bomb is? We only do this where there's been an area that's already being professionally cleared, and whenever a deminer finds a bomb, we'll just take the dirt that's around it and then use it for composite sampling. So I think there are ways to devise strategies to make to do good research while also creating a maximally safe environment, given conditional on the fact that I work on a minefield.
So I'm going to now go to the questions that the audience have asked. So in some ways, this is related to the previous comment that Marcel made about how, the it's unpredictable where it's going to be, but it's not unpredictable that these crises are going to happen. And this seems to be put in tension with this push to have community involvement, especially at the outset of research. And if the sort of researcher is poised to go wherever, then you see that it's hard to have community input. So the first question that an audience member has asked is, can you discuss examples of how the local communities, or if the local communities you work with participate or not in setting the research agendas or priorities for your questions?
Everyone is looking at me, and I will say it depends. It depends. If we are talking about time, I can give, for example, I can go back to the example of Ebola vaccine and Ebola treatment. One could say we decide in Liberia and Guinea that we are going to test those vaccines in the next epidemic, and that we are testing it now in Eastern Congo, and that the local Eastern Congo did not give the thing. But I just told you that the government of Congo approved those tests and eliminated the pregnant women. The local government of Congo is the local community, right? So because somebody needs to speak for the community. Obviously, in that area, you can see that we are not controlling because we lack the trust, because the government is also not very well involved locally. But that's another story. So it's important to think about what we call community. Because when we call about local community, people think like if somebody come at OSU and have to do something in this room, they absolutely need to come in this room before and talk to us and get all our permission, which is not true, right? Usually they will go and see Dr. Drake, and Dr. Drake will say yes and maybe send us an email, and we may read it or not read it. And then usually we know how we read those emails, right? And usually when the person show up here and say, yeah, but we were informed 3 months ago I was coming today. You say, really? Say, yes, we send you 3 other emails to remind you about those things and so on. And you say, really? Maybe that's true. And even this morning, you responded to one of those emails and you say, really? So that's what I'm just saying to say that community engagement, we are all community, right? And therefore, coming into this room, talking to Dr. Drake, it's relatively talking to this community, because we assume Dr. Drake is looking for what is best interest to us, even though Dr. Drake did not come to this room exactly at the moment he was talking. So I think we need to be really flexible in the way we define community. WHO participating, CDC participating in those definition in Liberia and Guinea of what we were going to test next time, we can say these are community that were participating, because their job in it was to look at what is best for the next community that hit, not what is going to make them money, because they will not make any money, whatever way this go from those things, right? So I think this is where we really need to think about the community more broadly, and rather than just exactly talking to the individual that is involved.
I'm trying to understand whether I'm local community or the other communities. I'm not really sure how to answer this, but I would probably say no, even if I am local community. I think from being from an LMIC, I find a lot of researchers coming already having decided their topic and already decided their agenda with not much participation from the community, whether it's local Malaysians or whether it's refugees or an HIV-affected community or whatever it is. I do think that participatory action research is getting more interesting and getting more people are getting more engaged in that, and I think that's great. In our acute disaster response with flood response and things like that, I don't see much engagement in the communities, and it is very government driven. But right now the response is quite good, so I think maybe they aren't so active in their research in that area. But in terms of refugee research, there's a lot more refugee representation, so I can see that that's definitely growing. But I can't speak to other places in the region.
Yeah, I don't know. I mean, from my personal experience, my own research agenda started from a laptop computer. So I was just like running some regressions on various types of data sets, and I like had found this trend that I just couldn't explain. And then I like went and read about unexploded ordnance, went to Cambodia, which I had been going to for years already, and then just started talking to people and then realizing there's a topic there. So to me, I think it's very useful if you can float between the worlds of like academia and the hollowed halls and then like go back to the field. It's like it's the most valuable thing is being able to go back and forth, I think, and just crossing those boundaries. And that's where you're always going to be the most impactful researcher.
So can you give an example of an appropriate research question that was in the midst of a humanitarian crisis, even in situations where some of the basic needs, such as water, food, or shelter, are limited? And they're like, so when is the appropriate sort of waiting period from providing the aid and sort of the first response and sort of moving towards starting to gather evidence and starting to conduct in explicit research projects?
I mean, I don't think anyone can give a time frame. I do think that when basic needs are met, then we can start thinking about it. But I've never heard of an appropriate research question if it's not within the operational research or implementation thing. When people's basic needs are not met, I don't think there's an appropriate thing. In terms of time, I think you need to be on the ground. You need to be assessing from there, like how people are they still traumatized? Have they had access, even if not to basic needs, like to health and mental health and things like that? I really can't answer that question.
My add on it will be just that it depends on the question and how the question benefit at a given time to the local population. Because if the research question is how do I better meet and rapidly meet the need of those people who are rapidly in need, then that question should be quickly done, executed, right? If it's how do I provide potable water in the new island that was created in Zimbabwe, Mozambique, how do I quickly do that? Then that question should be, you will be doing it on an operational basis, right? You don't need, because there is very difficult to randomize there. You're doing it on the operational basis. You implement those ideas as long as you go and then collect the data and do it. So it really depends on the question. What I say, I will go back to your example and say, as the bombs are falling, you cannot be on the ground picking the land to go test them, even though this may be. So you have to wait at least for everything to settle, for the peace agreement before you go do that type of research. So everything depends on the research question itself and how that benefit the present situation relative to the present situation.
So as a researcher, I mean, there's stuff that you can do while you're in the field, and then there's stuff that you can do when you're not in the field. And so there might be like an ongoing crisis, but you're still somehow able to collect data from like remote sensing sources or just like work with the partner organization that's like actively distributing the aid to make sure that there is information and like there is a sense of like data being collected about like how much aid is being distributed where, right? And like once it's like safe for you and your participants then to do some like post-op research, like then you can always go in and do interviews and surveys. But I think it's just important. I mean, I think there might be like there's not necessarily for me a distinction in like time periods of like when you're when you're allowed to collect data, especially if you can think of like more I guess creative ways where you don't have to be in field necessarily to do that.
So this next question is about the relevance of the research question. So do you think that research in humanitarian crises should be relevant to other more stable settings? Or is it actually really important for the research findings to have some, like to be specific and focused on the crisis itself?
Yeah, I think definitely needs to be relevant to that specific crisis, because then why don't you go do your research on the more stable settings where people are not so vulnerable, and because that sounds like almost exploitation to me. Like, oh, here's a place where I can easily access because everyone's going there, and I want to go and do this. And if there's a more stable setting, always go to the most stable setting, because there's just so much more at risk. So yeah, definitely.
Yeah, I don't know. I don't know if people perceive Cambodia as one of the more stable settings, because I guess I kind of perceive my research area as an area that can kind of be considered as a humanitarian crisis that a lot of people don't think about anymore because it's so far away from war and bombing. And so I think some people might label it as crisis or non-crisis, while I'm trying to provide evidence that there's still a lot of damage going on in the long term that we should be thinking about.
I think those who are in IRB or bioethics can answer this question better, because I think when you really look at it, if the research can be, this is considered vulnerable population. If you could do this research in a population that is not so vulnerable, who can actually consent freely, why not probably direct the study towards people who can consent freely, even if this is not getting in the way of providing them humanitarian help. It's just the notion of autonomy in this setting where the imbalance of power is so great. It's just that it lends itself to exploitation to very easily. And this is much more a question for people who actually review IRB for the safeguard and so on, to be actually paying attention, because as a researcher, usually we tend to be to dismiss all those relative red flag, you could call them, before on the time. So if they could be, if the vaccine that we are talking about in Eastern Congo could be safely given to other people who could be exposed to something else, to some antigen, to get that data, why going in that situation and trying to do it there? Because first of all, it's very expensive to do things in those conditions, and then it doesn't, and you may not necessarily get the best data you could get somewhere else if things were safe, because you are yourself not feeling very safe. So you don't go there and supervise as much as you could have done if you were in other conditions.
So since research relies on evidence gathering and objectivity, how can a researcher also be an advocate for the study participants? Is there an ethical imperative to be a researcher and advocate on their behalf?
This is my favorite topic, so I'll go first. I absolutely think that in humanitarian research, you have a duty to advocate, or at least assign someone to advocate. Because I know that not everyone is a natural advocate or activist, but I think it is you do have that duty and obligation to do that. And also, if your data that you've gotten is going to harm, I think you also have an obligation to make sure that doesn't get out and harm your participants. So there's so much responsibility with the data you collect. And I think informing the people that need to be informed so that service can be provided. I mean, that's the whole reason we do research. I really cannot understand why people would want to do research that doesn't have an impact on the population you're studying. I can't even fathom it. So yeah, definitely, I think it is absolutely a responsibility. And I think it should grow to become something that's normal, rather than something that means that you're a really good person or a good activist. It's just part of the responsibility. I don't work in academic institutions, so I don't know how exactly that can be made normal, but I definitely think it should be. And I think more engagement with the non-governmental sector is also really key to that.
So I see my role as a researcher as someone who shines light on a topic that other people might not have thought about before, and can provide a little bit more detail and nuance onto some just important phenomenon that impact a lot of people in the world. And so I guess I see my role as an advocate as like someone who almost speaks publicly to many different types of audiences and communicates about just some of my general findings, and kind of just shares the information with other people. So it's interesting because like when I actually do my fieldwork in Cambodia and I have all these one-on-one interviews, I feel like I'm letting people down a lot because they're asking for aid or for help that I cannot personally give them. But then like being able to then like do some hopefully quality research and then talk to various people from all over the place. And so I try to make it a point to present this research anywhere from like DC to demining headquarters in bases in Cambodia to like community colleges. So people just get a sense of what this topic is and get a little bit more engaged with it.
I agree with everything that I was saying, but I will be cautious because as a researcher, if we become advocate, we may promote our result to the expense of the natural doubt that have to come with it. We need to be humble. And as an advocate, there is not a lot of space for being humble. You need to be there, passionate, and saying this is it and it should be this way. And as a researcher, we need to be extremely humble because what people do not take the nuance we write in our discussion. People don't read those sections. Only people like you read those sections and read the nuance on the thing. You say all the long list of limitations you list on your research and say how this need to be. Nobody read that unless they are in academia like you. So, and therefore we need to be really humble. And my point is that, yes, I agree that people do not get in those settings just because they wanted to make few people may want to make a name. But generally in the health sector, people get into it because they want to make change. They want to impact other people's lives. So it's natural advocate. But here I will be advocating that we need to be humble because we are in an area where things change fast when we do not always have enough evidence. And we don't want the loudest person to be the one who defines the norm.
I think, sorry, I just want to respond to that. No, I just think that's a really good point because activists in general are extremely passionate and take things and that's exactly why researchers need to be activists, so they can be nuanced and they can tell the truth and tell things with research backing things up. And not to say that all activists are like that. I'm also an activist. I'm not like that. But this is why I think like we all need to do all the things because we need to make sure people. So even if you're a researcher and you don't want to do all that advocate and you publish a paper, like just make sure somebody's read that paper and has taken the right things from it rather than just the headline. I think even just a data dissemination seminar or anything with key people, even that is really great and will get your research to somewhere. So yeah, I think that. Yeah.
And I just want to answer that, and that my own practice is that when I go somewhere and do research, preliminary result is always presented before I represent at the local community because they have the insight of what is going on better than I do. You show up few days just because you have money and power and recruited few people and they do whatever they do and give it to you and you think like you know what was going on. That's not true, right? I usually have a ceremony in all my budget. I usually prevent that and discuss, and we discuss. And usually it takes a lot of time before I even submit it to anything that goes. It's usually very preliminary data because you have the preliminary data that I know will hold. But they don't need all the detail in because the limitation, they don't really spend a lot of time thinking about it. And then you go and discuss with them. And if you can give to them and say, really, I believe in this thing, I think this thing, they can take over from you and really be why you are the voice of the reason and say, let us not change everything just based on this.
So unfortunately, we have time for one more question, but this is a fascinating one. So what is the ethical obligation of researchers who are already on the ground when a crisis occurs within the context of an ongoing study? Must they stop their work and put their and then put their knowledge and resources in understanding the crisis and thinking about an effective intervention?
It's always depend because you may stop a research that could have prevented the next crisis, and that will not be wise. Right? That would not be wise. The question as a researcher, usually I say to, there is I'm coming from the College of Public Health, and this Sunday we were celebrating one of the founder of our college, and everything. What I hear there is that he said to his physician, the emergency department was being created and was under his department. And he told the chair then that if you don't do research, you are just a dispensary, right? The question is that there is a role for a dispensary and there is a role for a researcher in any single situation. As she mentioned, even in that crisis moment, we need to be collecting data. We need to be collecting data. And if you consider collecting data as a research, that means we need to consider research. Could the resources be mobilized from your question you were doing to answer other bases? If you read the report from the World Bank Commission that I just mentioned, their recommendation is to develop clinical capacity in low-income setting, and that World Bank should invest in those clinical because it can always be mobilized to respond to those crises. So, and what I say it depends, therefore, it depends on the importance of the crisis and how that will impact going forward.
I'm trying to think of how this question might relate to when I conducted fieldwork for my dissertation. And when I was out conducting interviews, I remember I had taken a holiday in Phnom Penh for a water festival. And there's everyone from the countryside comes into the city to observe just like boat races and stuff. And there was like a huge stampede where about a dozen people were injured and a few more died. And I don't know if that qualifies as like a humanitarian crisis, but it was certainly a dangerous event that could be researched. And I think in that case, even though I knew the country well and knew Khmer, like that was not a topic that I researched because I'm not like a social movement specialist, and that I can only bring limited skills to that particular setting, even though I like could have written like an ethnographic study, I suppose, of what it was like to be in the city at that time period.
I think that it really depends what your study is and what the crisis is. So if you or your research team are at risk, then yes, stop. If you're getting in the way of service delivery, if you're getting in the way of anything, stop. Just don't get in the way. Also, yes, you could take that time to understand the crisis, but don't try to rush and do a study. Just because you're there. I think that would not be ideal, but observational stuff is really important, and there's nothing like knowing a crisis than being there. Like then you will know. Then you could possibly do one for the next time, or do a post, do something after the crisis. So definitely, but yeah, don't get in the way.
All right. Well, with that, let's thank the panelists. Thank you so much for your excellent questions. And look forward to seeing you next month.